Welcome everybody. My name is Christian Malaster. I'm the CEO and founder of Ingenium Digital Health Advisors, where our passion is to enable the delivery of extraordinary care. We put together this event here for you, a week-long event with over 20 sessions from over 20 presenters to provide you diverse perspectives, different viewpoints into the world of connected health, telehealth, virtual care, virtual medicine, whatever you want to call it. Obviously, the COVID-19 health crisis has really catapulted healthcare into telehealth, telemedicine. A lot of us here at the Ingenium team have been at it for 10, 15, some even 25 years. And so this was our year, this was our day, so to speak. Unfortunately, it took a health crisis to really validate that telehealth is a very viable care delivery option. And it's something that the modern healthcare consumer has been demanding. Speaking of the term modern healthcare consumer or just healthcare consumer, this is something that I learned from Judy Chan, who's our presenter here during our fourth session of today. And I'm very excited to have her here share her expertise. She also has a book out that I'm sure she'll be mentioning, or you can find it afterwards. So Judy, really an expert in from the perspective of how we as people are consuming healthcare these days. I want to thank, before we get started, our sponsors, Thrive Health, Simple Visit, Adaptive Telehealth, and Ment. Thank you for their contributions here, for their support. All of them are really for really great telehealth, telemedicine technologies, all serving their own niche markets with a unique value propositions. If you have not come across them, once after the presentation, we'll go back to the conference floor and you can see and click around. Also, if this is a recording you're viewing, you'll see that in the show notes here. Just visit them and stop by and check them out, whether they are not a good fit to maybe some of the telemedicine challenges that you're trying to solve. With that, I'm very excited to have Judy here join us. Judy and I have known each other for, I think, coming up on 6-7 years. We met on Kiowa Island, I think, the first time, way back. And so really great to have Judy here join us today. Judy has many decades of experience in healthcare and at the intersection of healthcare and IT. She's been founder and president of her own consultancy, Health Pro Consulting, for over 25 years. Where she helps and works with healthcare systems, and really what she's focusing on is healthcare strategy for really reaching the modern healthcare consumer, and how can we serve this healthcare consumer in a touchless world, I guess, is the theme here. So with that, I'm going to stop my share, and I'll hand it over to Judy. Judy.
Thank you, Christian. So welcome, and today our topic is the touchless healthcare consumer. But I wanted to start out with something that was probably just a little bit not what you were expecting. That is. So, fun fact, what happened 1,155,754 times in 2020? Any guesses? Now, we're not talking about the over 500,000 people that died because of the pandemic. So this is actually something that's actually kind of fun. All right, so you have to keep it in mind. And here's the answer. It's actually the number of dogs who were adopted during the pandemic. So it's actually more than that, because these are the statistics from just one organization that collects actually numbers from over 2,000 shelters and other types of institutions along the way. So just keep that in mind. Everybody has a pet now, and the shelters are empty. You cannot find a rescue dog anywhere. They've all been rescued. All right, so let's get started. So there is not just one healthcare consumer. Today's pandemic-driven healthcare consumer was forced to use telehealth suddenly to avoid both becoming infected and spreading COVID. Because of this, people had to get used to a touchless world. No kissing, no hugging, no shaking hands, and no standing within arm's reach of somebody. So, in the beginning, you saw a lot of the elbow bumps. Well, even that's kind of gone away now. But healthcare was seriously disrupted, and telehealth became big news. So both providers and consumers had to have a crash course in learning how to have visits, to have the quality of in-person care, and then learn the technology at the same time. So overnight, that created people with telehealth experience. And the good news is that most of them had good experiences and want to continue using care. A friend of mine who's a doctor, she heads a lab, so she doesn't see patients. But she told me afterwards that during the pandemic, her doctor called and said, you can't come in for a visit. You have to do it by telehealth. And she was worried about it. She didn't know if the technology was going to work. You know, and this is a PhD, MD who works in, heads a lab for a large county hospital. And so afterwards, she told me that it was great. It was fast, it was efficient, it was easy, everything works. And she says, I'm going to do that all the time now. So there you go. Of the patients who used virtual tools during the pandemic, more than 60%, according to Accenture, plan to continue to use them to communicate and manage their conditions. So today I want to talk to you about the newly experienced touchless consumer. No one expects in-person care to go away. Health and wellness will consist of both in-person and virtual care. So what I'm going to show you is who this touchless consumer is, why do they want care this way, when it's appropriate, and how it will affect the future of healthcare delivery. So two things I'd like you to keep in mind. There are two key behaviors that affect healthcare. Number one is options. Consumers always want choices. And in healthcare, they want the ability to make the choice for themselves and for their loved ones. Number two, people always have questions about potential illness. If they have a symptom, they want to be able to know whether it's serious, should they go to the doctor, should they look it up? So they want to know if they're sick or if they are, what are they going to do about it? And so their answers will come from many, many different sources. So one of the best ways to look at health and wellness in the consumer is to look at them by generations. So here we have baby boomers, millennials, Gen X, Gen Z, and the silent generation. So one measure of the likelihood of being a virtual consumer is whether a person has a primary care physician. So the percentages you see here are the percent that have a PCP. So the biggest is the silent generation. Those are people who are 75 years old and up, followed by the baby boomers. 84% of them have a PCP. And then Gen X drops down to 76. Gen X are the people who are 41 to 56. And then the millennials drop even further. Now, the millennials are ages 25 to 40, and they are the largest generation. Their generation is bigger than the boomer generation. Now, also pay attention to the fact that millennials are the ones who have children, and they also, the older millennials, probably also have parents that they may be responsible for or helping to take care of. All right, and then after millennials, the youngest generation, of course, is Gen Z, which is 55% of those say they have a primary care physician. So now these are, Gen Zs are 24 years and younger. So this 55%, some amount of those are probably covered under their parents' insurance because of the Affordable Care Act. And the Affordable Care Act meant that you could be under your parents' insurance until the age of 26. So that 55% will probably include some group of those. A little bit more about Gen Z, right? This is the digital native generation. Like everybody from now on is digital native. This generation grew up with just digital. They don't know what a fax is, they don't know what a payphone was, and they don't know what a pager is. So these are the people who are most likely to Google their questions first, and then they'll ask their friends for advice. They are focused more on health and wellness, and many are likely to monitor their own health by making them the most likely to use wearable devices along with the millennials. A Gen Z member is more likely to have a close relationship with her doctor, but not because she sees them in person, but because she follows her doctor on Instagram. So let's look at a couple more percentages. Those who have a primary care physician usually lean towards in-person care because that's just what they're used to. So let's look at these percentages here. The blue, the circles were traditional care, and the virtual is the orange circle, and this is the overlap. So I'm just putting up the percentages here. So the silent generation, they have the largest percentage of primary care physicians, but also the only 7% of them would prefer virtual care over in-person care. For the baby boomers, they're just a little bit better at 9%. Gen X is at 22%, but then you get a jump with the millennials. So 33% of them would prefer virtual care over in-person care if they had a choice. And then Gen Z, of course, is at 41%. So, but millennials and Gen Z are the reason why providers need to pay attention to virtual care. And that is because the millennials are the single largest generation. They aren't using the most healthcare services right now, but millennials and Gen Z will show the healthcare industry what it needs to do to provide the best care. These groups want care that is as convenient as the technology that they grew up with. And so they have the most power to influence the future healthcare models. As Gen Z gets older along with millennials, they will create the momentum toward changing healthcare delivery. So this is actually the title of an article that someone wrote. And I edited the title and the picture. I didn't edit the picture, but I edited the title just so it would fit. The real title says, "Owning a decrepit shack in the middle of nowhere is the new American millennial dream." And why did I show this to you? Because it gives you a hint as to how the millennials think about their life in total, and that affects the way that they think about healthcare. Because they're the ones who don't have time to, they say, they don't have time to look for healthcare, and they don't have time to wait for healthcare. So if they try to schedule an appointment, they'll face long wait times. The average right now for a new patient to meet a doctor is 24 days. So, and this is not just for millennials, this is for anybody who becomes a new patient for a doctor. And that's just really absurd. I mean, I think a lot of people look at that and they say, oh, okay, 24 days, yeah, that's kind of long. But if you really think about it, if you're going to go and see a doctor and you're making an appointment to see a new doctor for whatever reason, because you change insurance or the health plan changed their network, you're going to sign up and you want to make an appointment because you have an issue or you have a question that you want to ask the doctor. Well, if you have to wait 24 days, the chances are you're going to say, well, it could be gone by then, right? The issue or the problem could have resolved itself, or it got worse, or you got worried enough that you're going to go to urgent care or you're going to go to have a telehealth visit. So nobody's going to want to go and make an appointment with the doctor, wait over 3 weeks, don't have any questions about their health, don't have any questions that they're worried about, and just pay over $100 for the copay and go and say, hi, how are you? I'm your new patient. Okay, that's it, right? Who's going to do that? Nobody's going to do that. So it's ridiculous. The 24 hours is just totally out of this world. So they consider themselves the busy. They use the walk-in clinics and urgent care clinics because they're convenient. They're open longer on the weekdays, and of course they're open on the weekends. And they're more likely to visit telehealth sites that offer virtual visits so they can get medical help at home without having to leave their house. So how do they compare with other generations? Well, first of all, they actually have the most medical debt. Now, I don't know why that is, but it could be that if they don't go for annual checkups, let's look at number 3, 93%, 67%, remember, of them have a primary care physician, but 93% of those don't ever schedule a regular checkup with their doctor. So it may mean by the time they actually get to the doctor that their condition is worse or more advanced or more serious. And so that ends up costing them more money. But they have the most medical debt. They also seek medical advice online more than any other generation. They exercise and read more on health-related blogs, and they believe, this is important, they believe that online information is as reliable as a doctor. And last of all, they're less likely to take prescription drugs. So Gen Z and millennials are the most dissatisfied with traditional care. They choose non-traditional care. And as I said before, that non-traditional care is walk-in and retail clinics. They'll do virtual visits. They'll do outpatient surgery hospitals, virtual health, and on-demand services. And in fact, they may actually choose a provider who offers on-demand services. And then digital therapeutics. Consumer expectations. So what do they think that they need? They want quality of care, of course. It'd be best if that quality of care can meet whatever they think that in-person care is. But remember, they're not satisfied with traditional healthcare. So what they expect for quality care that is non-traditional is going to be somewhat different than the traditional quality of care. Other than, we want to make sure that the treatment is effective, that it's convenient both in a channel, so it's accessible, and location, and that there's transparency about care. So that means tell me what tests that you're ordering for me and why you're ordering those tests. And then efficient operations. A good example of that is billing. Billing in healthcare has got to be one of the worst things ever. I mean, if you look at it, even if you only had something simple done, or you went in to have, you didn't have anything done, but the doctor prescribed some sort of medication, you look at the pages and pages and pages that you get for the bill, that also is ridiculous. So they also expect a focus on health and wellness, which is probably something that is very different from other generations as well. The silent generation and baby boomers are more used to going in and being seen when there's something that is making them ill or that they have an issue. So what are the basics of a quality telehealth visit? What makes a doctor proficient in touchless care? And here we're talking about video, not telephone or audio only. So the telehealth system has to be easy to use for both the provider and the patient. The doctor has to have a good website manner. She looks at you, she listens to you, she pays attention to what you say, and maybe in a telehealth visit, they actually have more time. Now, an example of a bad website manner happened, I don't know if you remember hearing about this a couple of years ago, when in the hospital, a doctor, he had a patient who was in the hospital, his daughter was with the father in the hospital room, and in comes this robot with the doctor's face on video. And what he was doing was telling the patient that he only had a few days or a very limited amount of time left to live. Now, so that's sad already, but because the robot for some reason couldn't go far enough into the room with the doctor's face on it, right? And I guess the patient was a little bit hard of hearing. Everything that the doctor said had to be repeated by the daughter who's in the room standing next to her father's bed. So he's telling her, and she's having to tell him that he's not going to live very long. So it's one of the worst examples of poor website manner, and actually, that's just poor judgment. What other things make quality telehealth visit? Doctor asks the patient to come in for an in-person visit when needed. Patients shouldn't be afraid that, if I do this telehealth visit, then I can't actually go in and see the doctor in person. So they need to make sure that they understand that. The doctor provides a diagnosis and explains the treatment for the issue that the patient is having. She makes the referrals as appropriate, and the provider sends follow-up instructions and a summary immediately following the visit. This can include referrals to a specialist, ordering medication, but it needs to be done right after. It also should include links to resources that the patient may need, either reading up further on the condition that the patient has. Sometimes it may be some physical therapy that they need to do that can make them better. So those kinds of things, but they need to be done immediately. So the provider needs to have access to those resources online. They order medication appropriately, and then of course, the doctor and patient determine which visits should be virtual and which should be in person. And that's important to have, especially with some of the patients who have a more complicated or complex health and need more complex care. So how do we elevate the patient experience? So there's a few things here. One is proactive outreach. Personalize the message to a patient to address the key causes of friction in a patient experience. And if you personalize it, people take that as if you are talking to them. You're not just talking to the general public. Next, meet them at the front door. Health systems can address unique patient needs and ease the COVID-19 related concerns before a patient steps foot into the office, if they're coming in, or if they enter into a virtual waiting room. They can also enhance virtual care options. So even though COVID-19 accelerated the need for virtual care, many patients were looking for it before and will continue to look for virtual care after the pandemic. So health systems can develop new care models that make care easier and more accessible with virtual care. And that will optimize the capacity to care for virtual patients and enhance the experience of virtual care delivery. This last one is listen to social channels. Continuing to listen across local market and national markets will enable gathering real-time insight into what patients and consumers are thinking and what the community is thinking about what's going on in the healthcare environment. So in doing this, healthcare organizations can quickly, pivot or change direction based on the shifting consumer mindsets and realities. Okay, so let's look at a hybrid journey for health, and hybrid meaning in-person and virtual care. So at the top, we have our happy, healthy consumer. They have a question about something. They may have a little issue or symptom. So they decide, okay, well, I'll make a telehealth call. Then they decide, okay, well, they may decide that they need attention right away. And either that came from the telehealth referral, or they may just decide that whatever it is that happened to them, that they would rather actually go see somebody. So that's where you have the walk-in clinics, and the patient would go to a retail clinic or go to urgent care. So if they have, a sprained ankle, they're not sure whether it's sprained or it's broken, that type of thing. Or even if they have a UTI and they need to be tested. The other thing they can do, of course, is schedule an in-person visit. If they are a new patient, they'll probably wait somewhere around the average of 24 days. If they're not a new patient, the time will be shorter. And most doctors leave slots for same-day care in their schedule. But whether you can fill that slot, depending on the time of the day that you call, and, unfortunately, it always happens that, I know in our family, that when things happen, they happen at the end of the day. So calling and trying to get in before the end of the day when you're calling at 3 o'clock, the chances of that are not very good. So depending on the issue or the condition or the diagnosis, you could be referred to a specialist by a telehealth, by any of the walk-in clinics, or by the doctor that was seen in person. Now, if they suggested that you have something like you needed to have elective surgery, such as a knee replacement or hip replacement, then you would go to a surgery center or a hospital for care. And then after that, depending on your condition and what it is that you were treated for, you may end up going to a skilled nursing facility for a short period of time, hopefully not a long period of time, and then you can go home. And depending on, again, what your conditions are, you will can have remote monitoring. Sometimes if it's an elderly person, you might want to have remote monitoring while they're at home. And then you become your happy, healthy consumer again. So any of these steps can be skipped, but basically this is kind of the journey that a patient really has to go to. So how can this journey be better? Well, just some ideas are that you may never need to go to a pharmacy and wait for your drugs. I mean, right now they do them by mail, but things that are happening with drones these days, and there are a lot of deliveries that are being made by drone. You've probably seen in the newspaper that drones are delivering contraband. So if they can do that, I'm sure they can figure out a way that they can deliver drugs. Lab tests, those eventually should be something that can be done at home, and the results are provided online. I mean, the reason why they're not done at home now is because they have these big, gigantic machines, and they want to do everything en masse. And that keeps the cost down. But advancing technology should change that. The other thing are kiosks. Kiosks can be placed at a central location, or places like at a school, where the patient can go in and the measurements are all captured by the kiosk, and you might have an assistant there, but essentially they can capture all the information that's needed. They upload it to the doctor, and then you get automatically connected to the doctor for a telehealth visit. So the point here is that artificial intelligence and advances in technology and the development of more sophisticated sensors will be able to take measurements and monitor a patient and require less in-person visits. These sensors are really getting advanced. I just want to mention that there is a sensor that people actually swallow. It stays in your system for, I don't know, a couple of days or so, does the measurements it needs, and that's it. Some of them dissolve and some of them are passed. However, it's all advancing. So in the end, the providers and the patients together need to decide what combination works best for them for the care that they require. So even though only 10% of consumers had used telehealth as of 2019, more than 75% of the consumers now report being interested in using telehealth, according to McKinsey. So what makes virtual care the go-to option? Getting care when the patient needs it and when the patient wants it. So that means convenient times, weekends, long hours on the weekdays, convenient locations, an online appointment schedule where you can change or schedule an appointment, cost transparency. People are afraid to go because they think they'll end up being slapped with a gigantic bill for their visit. So they want to know before they go how much it's going to cost them. I mean, it applies to everything from the checkup, from the time that you walk in, because there's co-pays, there's a percentage of payment that your insurance will pay, and you have a deductible. So there's all these things that are complicated for most consumers to understand. So another reason for virtual visits are that the waiting time for the provider is short or eliminated because there's no transportation time as well. You also don't have to wait a long time to schedule an appointment. So the right care, the right time, the right place, and the right price. So remember options? Options are key. So given a choice of virtual care for basic healthcare services, many would choose virtual. Many would also choose specialty care. So if we look at this chart, health and wellness, they will take advisories for health and wellness. 62% would prefer that as virtual care. 57% say that they're open to remote monitoring with home devices. And then even 52% said that they would do routine appointments. Now, these percentages are pre-COVID. So my guess is that these percentages are probably a little higher, at least now that COVID and a lot of people have virtual care experience. And then below the 50% mark, but still good in terms of percentages in the mid 40 ranges, that they would be open to having mental health appointments. And we saw actually during the pandemic that mental health appointments went up really, really high. So people were getting stressed because of the pandemic. There were a lot of requests for behavioral health appointments. And the only way that many places could handle that was to open it up to telehealth. They just did not have the time to do everything in person. Specialists for chronic conditions, specialists for diagnosis or acute care, and then, of course, diagnosis for illness and disease. So there are many healthcare delivery models to serve the touchless consumer, but everybody, right? So let's talk about the healthcare delivery models that are available. So there is the traditional in-person model, which are doctors' offices, clinics, hospitals, emergency rooms, right? A lot of people go to emergency rooms. Then there's the non-traditional in-person care, which constitute the retail clinics, the walk-in clinics, surgery centers, and urgent care. And then we have a combination, which is a newer model for medical practices now. And they offer consumers a combination of virtual care on demand and in-person visits. So you've seen this in One Medical. Forward is another one that offers this. And some of these, depending on whether they accept their insurance or not, are considered concierge care because they may take insurance, but you do have to pay a premium to receive all the services. But you also have access. A lot of them have access 24/7 simply because they offer online and on demand. And then the last one is online only. And these services offer telehealth for primary care, urgent care, specialty care. And one example of this is Hims and Hers, which offered specialized online services. But when the pandemic hit, they immediately expanded their telehealth access to primary care for a fixed fee of like $39. And the other thing they did to meet demand and just to help people was they rolled out mental health services with free online group therapy. So the point of this is that online companies can quickly respond to the changing needs in healthcare. So people are open and they have many ways to get care. All right, so I mentioned earlier that there was another group that was not included in the generations, and that is the digitally underserved customer. And the COVID-19 crisis underscored the long-standing problem of a digital divide. People who don't have computers, smartphones, or broadband internet are limited in their ability to use the services, and many Americans lack these things. I think it's more than 31.8 million Americans lack computer access. And I think many people saw this, especially among the school children. So all of a sudden, when they couldn't go to school and classes were being taught virtually, there were a lot of kids who didn't have computers or tablets to be able to connect to class. We saw this, I'm on the board of a local YMCA, and we saw this because there are a lot of immigrants in this community. And one of the things that we did was to open up the Y so that they could, these kids could come in and have, a computer to connect and go to class. Because a lot of them, even if they had a phone or something, they couldn't necessarily connect depending, because they didn't have Wi-Fi or a broadband connection where they lived. So it's a huge problem, and it just exacerbated it for healthcare, because telemedicine can help address that because it expands the reach to the digitally underserved to areas that are beyond the traditional brick and mortar offices, where doctors are not always easily accessible, or sometimes transportation limits a patient's health options. So 3.5 million patients go without care because they cannot access transportation to their providers, according to the American Hospital Association. So the key will be ensuring that the people who lack access to in-person care also don't lack access to virtual care. But we also need to make sure that virtual care is available and aligned to their needs. So COVID-19 created an inflection point. Patient experience has always mattered, but now the stakes have escalated, and health systems that don't respond to the new consumer demands risk losing patients to competitors. So many providers and patients quickly found the virtual services to be more attractive than they imagined. And the shift to digital channels is unlikely to be reversed completely once COVID-19 is defeated. Many providers and consumers wouldn't want that anyway. So the pandemic forced providers and patients out of their comfort zone, but they can't go back because that comfort zone doesn't exist anymore. So they need to find and create a new comfort zone for the delivery of healthcare services. So now is the time to transfer and grow the market by exceeding the patient experience expectations. Take advantage of the disruption that occurred. The disruption is a huge opportunity in the way that healthcare services are delivered and accessed. This historic change brings healthcare providers and payers an unprecedented chance to permanently shift the default care model to virtual services. And so people will go from being forced to use virtual services to voluntary digital health adoption. Traditional healthcare was dominant prior to the pandemic. And before the pandemic, they already had a strong interest in virtual care services that included wellness and health. So consumers are interested in comprehensive virtual care, not just illness care, right? But true health care and wellness care. And this number will only get bigger, the number of people interested in comprehensive care, because Gen Z and the millennials, they'll get older and they'll start using more healthcare, and they're expecting more. So now virtual care and traditional care will take healthcare to the higher level of care. So overall, we will see more healthcare consumers where touch is an option in their pursuit of wellness and health. So thank you. And let's see, do we have time for questions?
Thank you so very much, Judy. That was a really comprehensive overview, and I liked all the statistics that you brought in. Yeah, can you hear me? Can you hear me, Judy? I'll just end your screen sharing here so we can bring up your slide again. Let me just see if that, Judy, can you hear me?
Okay, now I can hear you.
Okay, good. All right, well, if you click on the share button at the bottom, it's going to stop your screen share. So otherwise, there we go. Good. Well, thank you very much. As of now, we don't have any questions by the audience, but we've got a number of people in the audience. So if anybody wants to ask a question, please post it. Otherwise, we'll be moving here back onto the floor, and you can meet Judy in the Meet the Speakers room directly and chat with her. So no, I mean you're touching on a lot of the different points that I always emphasize as well, and it was just great. Again, it was to some extent also preaching to the choir here. So this is a brave new world, and the aptitude is there. The people want it. People love the convenience, and so yeah. So I really definitely enjoyed that. So good. Seems like there's no questions coming in right now. Matt Feynman says, great presentation over there in the chat. So and that's good. He's a physician and a telemedicine practitioner himself. So it's good feedback. Great. Good. With that, thank you for preparing the presentation. Okay, Mary says, any thoughts? Consumption shifts for millennials, from Mary.
Content consumption shifts. What kind of content are we talking about?
Mary, I'm gonna let me hang on here. I was typing quickly. Mary, if you don't mind, I'm gonna invite you up on stage here because we're a smaller audience. So I'm now giving you I'm going to invite you up the stage. Yeah, I'm helping you up the stairs. And if you'd like to ask your question live, you can just turn on your microphone. You could also turn on your camera. I know you're not camera shy, but yes, please to ask Judy the question directly.
Hi, thanks, Judy. That was great, and I love the stats. But when you spent a good amount of time talking about the differences between millennials and how they are much more likely to research online and seek information online. And you may not have this, but I was just wondering, with fragmentation and with how the market is getting busy, if you had any thoughts on their shift in content consumption and also the way the market right now, and hopefully this is a phase in America, but where credibility in content is changing, and I don't want to call it fake news, but content is coming from a number of sources now. While they are more likely, because they're digital natives, to go and seek answers digitally first, is that shifting or changing based on credibility and where the content is coming from? Or are people starting to go, more likely to refer to other consumers for the versus experts? Or how is expertise, credibility, and social maybe changing the way that audience, or the next generation behind them, is going to consume health-related content or see their actual catalyst to making an appointment, where they're going to make an appointment?
So, I mean, the interesting thing about the millennials is that they believe that whatever they read online is as good as what a provider is telling them.
Okay.
But the other thing, one of the things that I didn't go into, are that patients trust their doctors. And if their doctors told them that they should engage online, and that there's things that they can do, or that they should have virtual visits because that would help them, depending on if they have issues or not, they would do that. But I don't know what to, because they go to so many sources, and in fact, Gen Z is even more like that, right? Like they'll follow an Instagram on
Right.
a doctor, which is, unheard of for my generation. I'm just getting used to what Instagram is now. But that is really, these sources are from all over the place. And as I mentioned, I think that they get a lot of them from, if it's not their doctor, that they trust their friends and their family.
Sure.
So, I think that that's where they'll double check. So it really depends on how good your family is, and what kinds of things that they've had, and they'll get advice on that.
Sure. Thank you.
It's a good question.
Great, thank you very much. Doesn't seem there's any other questions out there. Again, if you're new to the remote platform, we're going to be ending the presentation mode here. We'll be back on the floor, and now we're going to be, and then you're going to be able to double click on where it says meet the speaker, and you'll be able to join Judy, because I think that's, well, the system will place Judy there right away. And with that, yes, thank you very much for putting this information together and sharing it with us. And yeah, people can reach out to you, and I'll also give you a list of the attendees and afterwards. So great.
Great. Thanks, Christian.